We can use the anatomical position to visualize our patient from the outside of their body, but if we want to refer to structures on the inside as viewable with imaging techniques, we have to consider what are called sections or planes of division. And this means that we have to understand in what direction the body is being divided and what the resulting image would look like. So let's consider a banana here and consider how dividing it top to bottom in this picture would look completely different than it would if we divided it side to side. Also, consider these other fruits that we have here. If we were to divide this avocado here, we would get a section that looks like this with the pit in the center. If we were to divide this apple here, we would get something that looks more like this with the seeds. And I don't think that I can really draw a tomato, but we would get things that kind of look like this with all of the seeds in here. So these can look significantly different. And in this class, it will be very important for you to develop a mental 3D structure from looking at 2D pictures. And I mean, this is what radiologists do all day long. For example, look at how dividing a blood vessel, which is basically just a tube, there's a blood vessel. But think of how dividing a blood vessel, depending on the plane through which it is cut, right? If we cut the vessel long ways, it creates a completely different view than if we were to cut it sideways. So the planes or the sections in which it's cut make a difference in the shape of the picture that you see. We could also cut this obliquely or on an angle, and it would produce something more of an oval. Sagittal sections cut the body into a left and a right section. The term sagittal comes from a crest that runs right down the midline of the back of your skull. In fact, many of your chewing muscles are attached there. Therefore, a mid-sagittal section cuts the body into two perfectly equal right and left halves. And I'm going to try to draw something like that. There we go. That's my drawing. Okay, so other sagittal sections can divide the body into right and left halves. However, some sagittal sections, those right and left halves, are not equal. And in that case, we would actually create a very, very different plane. In fact, there you just have the arm and a little bit of the hip, right? So however these two halves are not equal, you still get a resulting picture. In this class, we will most likely just say sagittal and leave it up to you to determine if it's a mid-sagittal or another off mid-sagittal section. But what you have to do is you have to think of the outline that is produced from a sagittal section. And that many times it looks much like the outline of someone if you were viewing them from the side. Frontal sections can also be called coronal sections. In fact, when we say frontal, we're usually referring to like the entire body, and coronal sections, that term is usually reserved to when you're talking only about the head. The word coronal means crown, which is also the picture that's on Corona beers. So connecting your forehead to the rest of your skull is a suture that is called the coronal suture. And frontal sections run along a coronal or frontal axis, dividing the body into a front and a back section, much like this. right? Dividing it into an anterior and a posterior section. The term coronal is used usually to indicate that there are two equal sections of division. However, the use of the term frontal usually refers to two unequal sections of division. In our class, we will most often use the term frontal. For a frontal section, think of the outline of a frontal section can make. If a patient is standing in front of you in the anatomical position, then you cut them in the frontal section, their outline kind of looks exactly the same. I once read a book that was really helpful. It said that when you think of sections, think of the dividing line as a plane of glass, right? And how that plane of glass would look if you were to take the anterior section off, what would the posterior look like? Transverse sections cut the body into a superior and an inferior section. So we could cut here into a superior and an inferior section, or we could also cut right here into a superior and an inferior section. These sections usually depict organs with shapes that seem somewhat recognizable by students. For example, you may be able to think about what your kidneys look like by thinking about the shape of a kidney bean. When we cut or when we receive transverse sections from imaging such as an MRI or a CT, the image is portrayed from a vantage point that is strange. It's the bottom looking up, not the top looking down. So a transverse section of the kidney would actually look a little bit like this, right? Looking top down, there's that indentation right there that's happening. Transverse sections also include a category that is called oblique sections, and this would be if you were to cut the body on a diagonal type line. I also just wanted to show you this here, a superior inferior section would just look like this. It would just be two legs. Here, the superior inferior section might look something like this, where you've got the main body and then the shoulders. Although anatomical directions help us refer to a patient's body verbally, we might need to be more specific when we are referring to internal organs. For your squishy organs, we can use internal body cavities to refer to their general areas. You kind of have these compartments in your body in which organs are encased in a sac or a membrane or like a fluid-filled bubble. And those sacs, it's kind of like a modular home. The thoracic or the chest cavity actually contains two bubbles. It contains the bubble called the pericardium, which contains your heart. But it also contains this bubble that is called the pleura, which contains your lungs. The thoracic cavity is separated from the more inferior abdominal cavity by the diaphragm. And I know I drew that just a little bit too low, but this is your muscle of breathing. I once did an outreach with fourth graders on the respiratory system that someone in our department organized up at the Victor School System. And I just remember all the students were saying diagram. And I remember by the end of the day, I was like, yeah, diagram. So some people prefer to call the abdominal cavity the abdominal pelvic cavity. Some people prefer to consider the abdominal cavity and the pelvic cavity separately. The additional cavity that sometimes can be referred to as the dorsal cavity is this sac that contains both your brain and your spinal column. and we refer to that sometimes as the dorsal cavity. It depends on which book we use. This sac completely separates your central nervous system, the brain and the spinal cord, from all other tissues in the body. And this is why you need a spinal tap. A spinal tap is required for you to sample the fluids surrounding your brain and spinal cord, because those fluids are not blood. Many of us are very familiar with imaging techniques from our own experiences as a patient or family experiences as a patient with patients with healthcare. People are usually very familiar with x-rays that are excellent in looking at solid structures within the body. This dental x-ray up here is excellent for looking at the teeth that are embedded in the maxilla and mandible. MRI and CT scans can often be confused with each other, but both of them provide similar resolution or sharpness in viewing soft, mushy structures of the body, such as the spinal cord. One of the big differences between an MRI and a CT scan is it's the amount of radiation that the patient receives. With an MRI, there is, wait, let me think about this, none. With the CT scan, there's about a third of the radiation that you should receive in one full year. I think that's right. It's something equivalent to like 3,000 x-rays. Spiral scans are also very specific ways to take CT images, and they are usually used to image areas that have high surface area, like the lungs. PET scans are usually combined with CT scans, but the PET portion of the scan uses a radioactive dye that will help the radiologist visualize very specific squishy structures. These techniques here are used internally to image body parts. You can take pictures from an internal vantage point. An echocardiogram is usually taken from within the esophagus and is very effective at visualizing the heart muscle. An angiogram is a visualization of the coronary vessels that lie on the superficial or outside aspect of the heart. Endoscopies, colonoscopies are both used to visualize the digestive system, just from different ends. And a colposcopy visualizes the lining of the uterus and or cervix, but also allows us to take cells that will then be able to be viewed on a microscope. The last imaging technique that I have is over here on the left, which is ultrasound technique, which can also be used to visualize squishy organs, but also can be used to visualize tissues that are in flux or in the process of being shed or built.